So I'll now pass you over to Fiona and ask Fiona to do a brief update.
Thank you, Nigel, and I will keep it very brief because I know we want to hear the majority of the session, the input bit from Sarah. So I think as you'll know, I talked at one of the previous sessions about the recovery strategy for the city and the 3 areas of focus on that. So in terms of economic recovery, clearly a big focus of ours is around the economic recovery work stream, and that as I've said before, is fundamentally about ensuring that we are supporting jobs in the city and ensuring that we do retain a level of employment, and that as different sectors reopen, that those jobs and that employment remains there for people. That is a challenge, as all of you will know. But for across the different sectors as well, you will have seen lots of lobbying activity from the council, from different executive members to different government departments, and our city treasurer, Carol Culley, and our leader and other lead members continue to speak directly to government around the funding and issues around employment and the economy for the future. In terms of residents and communities, we're continuing there our focus on vulnerable residents and those most at risk and most impacted by Covid-19. And I've talked previously around the work around vulnerable people and you know, the work that we're doing to sustain the support that will be required for the future, including around food support. And then in terms of the future council, that's clearly an area of our focus as well. And none of you can fail to have seen the challenging situation that all councils are finding themselves in terms of finances for the future. And that's a big work in progress, and there will be a lot more about that as the year goes on. But as we move out of the significant restrictions and as we start to see different sectors opening up, it's really, really good to start to see some of our services now coming back online. So our libraries, we opened 8 of our libraries earlier this week. You'll have seen the non-essential retail now starting to open, and the hospitality sector that opened, or majority of it opened last weekend on the 4th of July. And there was a massive operation to support that, to ensure that the city was able to manage that effectively. There's a lot of work going on with our schools, and the guidance for schools, as you know, has just been refreshed. So lots of discussion going on around how best to support schools to manage the reopening for all pupils in September. And importantly, I know a lot of you are involved in that, the summer programme. We did have refreshed guidance this week that enables some of our youth buildings, our youth provision, to reopen for groups of 15, but still better than where we were 2 weeks ago. And there's a lot of work going into planning for that summer programme. There was a couple of reports that went to various committees over the last few weeks. So there was a report to executive on the 3rd of July that sets out a lot more detail of what I was talking about, and various scrutiny committees at the end of June. And all of those can be accessed through the council website on the Democratic Services link there. But if anyone needs to get them, I'll speak to Nigel about how best to access those. But key to moving forward is the testing, tracking and tracing capability, and you'll see right across the country how important that is to managing the lifting of restrictions and making sure that we move forward in a safe way. And Sarah, one of our public health consultants, is here. You might have seen that she's now become a local celebrity because she was on social media and in the news all last week. So, and what we do know is that we have got some of the very best specialist experts in our city and in Greater Manchester, and Sarah won't say that herself, but I will say that Sarah is one of the best in this field. So she's going to talk to us a little bit about the work that we're doing in Manchester and Greater Manchester.
Just before we move on to Sarah, Fiona, is there anything more you can tell us about the kind of government support for Manchester City Council in terms of the amount of money, because we're all very aware of the financial crisis in the City Council?
So the funding that has already been announced so the two tranches of funding is where we are for the moment. So there is, whilst there's lots of discussions going on around the various levels of support that's needed, and lobbying and discussions continue through local government association, through core cities, there are no further announcements at this stage. So we're no further on, if you like, in that phase at the moment.
Is there a date for next announcement?
No, we haven't got a definitive date for a next announcement. The government are talking about the spending review, which will probably come later in the year. So we haven't got a definitive date when we will get more detailed information on any further settlements at this moment in time.
Thank you, Fiona. And so over to you, Sarah. Thank
you. And just to introduce myself, I'm a consultant in public health. I'm not a doctor, but I'm still all right. My colleague Cordell Mbeladogu is a doctor, and she's a consultant in public health medicine, and I'm a consultant in public health. But my role is to lead health protection work as part of the team. Obviously, David Regan, as Director of Public Health, has got statutory responsibility for health protection of the people of Manchester. So it's my role to work with David to ensure we can do everything we can to try and keep people safe. So just before I start my presentation, I just wanted to say a few words really. So my work on the coronavirus started when I came back from a Christmas break in January, and I've been working on it so far. So at the time, our public health team and colleagues at Public Health England and others in emergency planning and resilience, we were hoping for the best, but we were preparing for the worst. And Fiona and her team, with experience around the emergency planning work and resilience, were all part of those conversations. We had our first case in Manchester on the 7th of March. And obviously we were putting measures in place then to try and contain the virus. But as we moved into the pandemic phase of the Covid-19 incident, it was recognised just how serious this was. It is the worst public health crisis of our generation. And it's the largest challenge that most of us have ever had to address. And for all of us, it's probably the single largest thing we'll probably ever do in our careers in terms of a response, because it's a situation that's going to last for years, not days, weeks, months, like other emergency situations we have. And I just wanted to say at the start how grateful we are as a public health team and as a council that you've worked with us in a joint response along with other organisations to try and manage this pandemic. So I'll just upload my presentation. Can you all see that okay? Yeah. So my role in the public health team, I manage the community infection control team. So before COVID, that team was a team that did all the outbreak management work for anything outside of hospital, so the community outbreak work. So we would work with schools and other settings to manage any outbreaks they had. But obviously with the scale of the COVID-19 response, we've needed to pull in lots of other colleagues from public health and other teams to be able to provide more of a service, setting up testing services, setting up contact tracing, which was much bigger than our small team of 4 people could manage. Trying to make it, oh, there we go. So this slide just shows the different elements of our public health response to COVID-19. And you can see along the top, outbreak management is the key piece of work we need to do. And the elements underneath all contribute to how well we manage outbreaks and how well we contain them. So the infection prevention and control work is work that you will have been doing within your voluntary sector organisations. So work within either buildings that you have or with your staff you work with, but also with communities you may work with through delivering your work. And this is about having advice and support and solutions in place to protect residents from COVID-19. And I'll go into more detail about that in a bit. The other aspect is it's really important that people who need a test can get a test. And so one of the key strands of work which Cordell, my colleague, has been leading is the work around testing. And that's been a complicated system because of national testing arrangements. And then Cordell's role is around leading any local testing that we need to organise and making sure that the system all works together. The third element is the trace element, the contact tracing. So that's about anyone who tests positive, their close contacts are identified, and then we're putting measures in place to slow the spread of the infection. And I'll talk later about our contact tracing work. Who is a contact by the definition we're using for this piece of work, and what do contacts need to do if they're identified as a contact. And then the last element, which has been an element that Fiona and the team and others have put in place, is making sure that those who do need to isolate for whatever reason are supported to be able to do that safely, so that they've got access to healthcare, social care, but also food if they need that. And obviously all the work that we're doing is underpinned by the best available evidence, data and intelligence that we have. That's information coming nationally, but also our local information and knowledge, and information that we get from people like yourselves who can feed in things that you know about or have heard about, particular situations that can help us to do the outbreak management work most effectively. So I'm just going to quickly go through infection prevention control measures. You will all be aware of these, so I'm not going to dwell on them. But because there is no vaccine for COVID-19 and there isn't treatment for COVID-19, we have medication available to be able to make people more comfortable and try and help them to recover, but we don't have a treatment for it. So more than anything else, the infection prevention and control measures are so important. So these are things that you'll be aware about already for yourselves and your own families, but also for you when you're coming together with colleagues and things start returning to normal, but also when you are providing services with communities and others around what you need to have in place in any buildings you use or in about the way that you're working. So the social distancing, obviously you're aware of, people washing hands properly and regularly and using hand sanitizer if hand washing facilities are not available. Hand washing is the most effective way of making sure that you don't spread COVID on your hands by touching surfaces.
Sarah,
yeah,
I'm just very aware of how many slides you've got.
So I'll just pass this one on then.
Yes, I would just say I would move on fairly quickly because people know about onto the test, track and trace.
Okay, right. I've put risk assessment in this slide because that was one of the questions you asked about, but obviously I think people have already done that now, so I'll move on from risk assessment as well. So one of the things, I'm not going to go into detail about this slide, but this was about the risks, and this is about you risk assessing your staff, but also the risks with communities that you're working with and communities who may be more at risk from COVID-19. So these are the clinical risks, people with clinical symptoms that make them either at high risk or moderate risk. But there are other things we know that can affect your risk of COVID-19. And these are being older, being a man, the country you live in, and being from a Black, Asian or minority background, living in a care home, and people with certain jobs are more at risk of COVID-19. And this is important as part of our response. I think one of the questions that was asked was about the response to what work we're doing around the BAME communities. And so related to that, we have set up a COVID health equity group which Cordell is chairing, which is about how we're going to work together as a system to address the disproportionate impact of COVID-19 on particular communities. So I won't go into detail of this. You'll be able to have the slides afterwards. So the key thing to know about the what to do is the symptoms. So they've added taste or smell to the symptoms. So if you have a cough or high temperature or loss of taste or smell, or any of the clients that you're working with you need to advise people you need to stay at home and get a test. And the way to get a test is by phoning this number or going on the internet. And it may be that you may need to support people to do that if they're not able to organise that themselves. And then the contact tracing work starts only with someone who's tested positive. And the key message that we're trying to get across to people is that our contact tracers from the national NHS team and our local team will never ask people about money, passwords, or anything to do with their bank. And any help you can do with communicating that to communities and residents is really important. So this is the work about contact tracing. So if someone has tested positive, this is what the contact, if you are a contact, this is the definition. So the first thing to realise is you're infectious 2 days before you get symptoms and for 7 days after. And we know that some people don't show symptoms. So we would go from the 2 days before the test and the 7 days after the test in that situation. So it's really important that people remember where they've been and 2 days before they start to get symptoms and after, and who they've been in contact with. So a contact will be someone you've been in less than 2 meters apart from for over 15 minutes. So you bump into a friend in the park, you stood there within 2 meters distance of them for 15 minutes, and they would class as a contact if one of the people tested positive. Similarly, if you're in contact with someone from less than 1 meter away, so you've ordered a takeaway, you go to the takeaway, you chat to the person who's serving you the food over the counter for a minute. Just 1 minute in close contact is enough to make you be a contact to someone who's tested positive. And then there'll be household contacts, so people you live with. So someone, if you live with a partner and your teenage children, they will all be contacts. But also if you live in shared accommodation and you're sharing bathroom or kitchen facilities with people, all the people who share those facilities are going to be identified as contacts. And what we're asking people to do is, if you are a contact of someone who's tested positive for 14 days, you need to isolate for 14 days. So this means that if you are now opening up your services and someone's tested positive and you have any contacts within your organisation, every member of staff who is identified as a contact will need to stay at home for 14 days. So really important around your resilience plans and workforce, about how you work together as a system to make sure really essential services can continue to function if staff need to isolate. You won't need to isolate if social distancing has been put in place and there's been all the other measures, the infection control measures I talked about earlier, put in place. So that's why they're more important than ever to allow us to get back to services opening and being able to provide service for people. So the outbreak management work is the key to be able to spread the spread of infection. So an outbreak in COVID-19 terms is where you get 2 or more confirmed cases linked by time, place, or person. So if one of your community centres opens up and you're providing a service from that, if there's 2 people, either a staff member or a service user, that's 2 people, it's an outbreak, and that's classed as an outbreak, and we do our full outbreak management support around that. We may have situations, so what we call an outbreak situation, where we know there's 1 confirmed case, but there's other people we're seeing what's happening with the other people. So that's a situation. We still need to know about these situations to enable us to be prepared to act quickly if we get more cases. Because the testing and contact tracing work that's done are really essential elements to helping us understand and manage outbreaks and slowing the spread. What the system we have is, if we have an outbreak and it's small and could be managed by our infection control team, at that point we would manage that. It may be that I would call an outbreak management control team meeting, which would involve someone from the setting. So if it happened in one of your workplaces, someone from the workplace would be involved in that meeting to see what we would need to do together. We would also involve someone from Public Health England if it was a more complicated situation. If it's small and contained and we manage to stop the spread of that outbreak, that's fine. If it escalates further, so we get more cases, or we suddenly get more outbreak situations in a similar area, so one of your organisations has an outbreak, a local care home down the road has an outbreak, and the local school has an outbreak at the same time, that then is what information that informs what we do as a whole Manchester system, and any outbreak that is large or of concern because of the vulnerable people it affects, or because of any other reason that we think needs escalating, it's my role to make sure that David Regan is aware of those, and he would escalate that to the MCC Gold Command meeting, which Fiona is part of. And then the Gold Command would look at the situation and see what we needed to do as a city. And what I would say is, if we find that we've got several outbreaks in a similar place, geography-wise, I mean, it would be really useful to work with you and your organisations and the communities to do some real local community work, because we're looking at the infections across the city, and as if there's a particular area where we're seeing more infections, we would want to go in and do some extra work in that team, working with our neighbourhood leads, working with the VCSE organisations, working with anyone as we come together as a system to manage the response. So that is how it would work. So what I've done here is just pulled together some email address for the main contact for anything relating to test and trace to come through to. So you email that. And there are links below about campaign resources, the guidance from Public Health England, which is changing on a really regular basis. So I would urge you on anything to check the most up-to-date guidance. I've put an example of guidance for the safe use of multi-purpose community settings, because that's likely to be some of the areas you may want to be opening up again. That latest guidance was only published 2 days ago, so I'm not sure if everyone has seen that yet. And I've put a link to our local COVID-19 prevention and response plan, which is on the internet, and that's our whole system response, and it describes all the elements of the work that we're doing as a city. And obviously your organisations are absolutely key to the delivery of that plan, along with the rest of the system. So I will, and that's just a headline of what to do in those situations. So I'll stop sharing now and I'll take questions.
Thanks very much, Sarah. Fascinating. And the slides, we will send the slides out to everybody, and so that you will have all of that information. The first person I'm going to call on to ask a question is Isabel. Isabel, could you unmute yourself and ask your question?
Yeah. Thank you. I won't ask the first question because it's been covered, but there are a couple of things. First of all, in your contact, are they going to be adult and children? The reason I'm asking is because I own 3 nurseries in Manchester. And then how are you going to contact people? Is it going to be by email? Is it going to be a text? Is it going to be a phone call? And the reason I'm asking, because there have been a lot of scams going around. So we want to make sure that if we're being contacted, it is real. And then lastly, it's just making sure that by us giving people's details, we're not breaching any kind of GDPR, which I don't think so, but I'd like it to be confirmed.
Yeah, okay. Shall I answer that question first then, Nigel?
Yeah.
So the contact tracing and the testing work involves children and adults. So children are contacts as well as adults, and early years settings, schools, childminders, everyone would be part of, anyone who's come into contact with children would be part of the system as well. So what happens if someone tests positive, their information goes from the lab straight to the national test and trace system. So it isn't a case that you need to ring anyone up and tell them about your results. Obviously, if you've tested positive, it would be best to tell your manager at work and you've got colleagues, so that could be managed, and also people you're close to. But the system for the contact tracing starts by the lab sending the results straight to the contact tracing service. Now, in a simple situation, contact tracing situation, where it's one person who can easily identify their contacts, the contact tracing service would then contact their contacts and say, you've been in contact with someone who's tested positive, you need to isolate for 14 days. So that work would be done. But what we know is that from a local level, there are situations such as outbreaks in schools or care homes or homeless settings where we locally need to be aware of those, and we need to work as a system to support those high-risk settings, high risk from COVID settings. And so what happens is the information about that contact tracing is fed through to our local system, and it comes through to us. And what would happen is people would be contacted by either a phone or email initially, hopefully contact by phone, and start that initial conversation. And it's a bit like being a police detective, where you're trying to investigate who's been where have you been in the last so many days, who are the people, and they put this big picture together of the contacts. Usually, I think the average number of contacts for people who've tested positive is about 14 people. So the work then needs to be done to contact these. But if say, for example, it's a young child who's been attending a nursery, the contact tracing coordinators would ring up the nursery and say, a child in your nursery has tested positive for COVID-19 and they were infectious during this period. So they'd give them the certain dates. Between these dates, can you tell me which children and staff members worked and were in close contact with that child? And then what they do is have a conversation about each of those and say, are they really a contact? Because if they've had PPE on, or if they'd had the 2 meters distance, then they'd be discounted as a contact. So you then work through your big list of lots of people and cut it down to these are the real contacts. And so the nursery's role would be to then send a letter to the staff and also to parents and say, your child now needs to isolate because they're a contact of someone. So what we're doing is using our local systems to help us do the contact tracing. So a parent is going to trust the manager of the early years setting that they know what's happening and that they're working with us. So that's what we're doing around that. You will have heard that people, if they visit a pub or somewhere, are being asked to give their details for contact tracing purposes. And it's just for this reason. So it's so that if someone who's been at the pub at the same time as you tests positive, and they say, when the contact tracing is done, they said, oh, I was in that pub on Friday night. Again, so we contact the pub, and the pub has a list of everyone who was there during that time, and then can let us know, and then we can do the contact tracing work. So that's why people are being asked to give their information. It's important to give the information because it's a health protection issue. So it's a bit like a safeguarding issue. It overrides other things because it's for health protection purposes, and it's to stop the spread of infection and prevent people from dying. So it's important that people share their information for those purposes.
So Sarah, we've seen that pubs and cafes are recording who's coming into their premises. Is that something that you're encouraging voluntary sector organisations to do as well?
Yeah, I would think any setting that has people coming in for whatever purpose, I think it would, there's actual new guidance on there's new guidance on the website. So if you follow the guidance link on the PowerPoint, there's guidance around taking people's details for contact tracing, and it would be the same for places of worship, anywhere where people gather. And the important thing is that recording the date and the time they were there, because if I went to a pub on Friday night and I tested positive, if I was at the pub at 8 o'clock, all the people who arrived before 8 o'clock aren't contacts because I wasn't there then. So again, the detail of the time they arrive as well as the date is important, because it just helps. It means that they don't have to isolate for 14 days unnecessarily, and we get the right people isolating.
Thank you. Okay, I'm going to move on, and I'm going to apologise now for the people that I don't manage to for them to ask their questions. The next question is from Duncan.
Thanks, Nigel. Sarah, I suppose it's a little bit of a follow-on question actually now that Isabel talked about. So Survivors Manchester is an organisation that works with male victims of sexual violence across Greater Manchester, so based in Manchester and Salford, but we work across Greater Manchester. My understanding of the test and trace and track service is exactly as you were saying about collecting data and passing information on. And I understand in terms of like it's a bit like a safeguarding, but for certain services like mine and some domestic violence services, there is questions of anonymity, but there's also, and this has been a big surprise to me as the leader of this organisation, is that there's been quite a few people who prior to lockdown would come for therapy, would come to access services, who actually haven't been able to because the people they live with don't know that they're a sexual violence victim. So it's unsafe for them, or there's confidentiality issues in their home. And whilst I absolutely take on board the idea that passing information over is a public health issue, have we thought about how this potentially becomes a barrier to victims in really sensitive areas?
I think you made a really good point, and we need to do more work on this. I've visited your service quite a few years ago, so I know the service you provide.
Yeah.
One of the things that would be helpful is we've tried to be thinking around even like the telephone numbers that we use for people experiencing domestic violence. We don't want those to be tracked like the same. We're ringing from Manchester Track and Trace, and then it's like, oh, we're in Manchester then. And so we are conscious of those things, and we're trying to work through. What would be really helpful is if we met with you and went through in detail, because what we could do is have a situation where you would take note of the people who attended the service for therapies or for advice, but that would be kept by you, and we could contact you and say that someone within the service has been in contact at this time period. Please you contact the people that you're aware of, this is the advice we'd like you to give them, and you do that. So we don't need to know their information. What we need to know is that you've worked with them, and we know that they're isolating and that they're safe.
Okay.
So there are ways around doing it they'd be coming to your service anyway, and you can explain to them you're not going to share that with other people. So in my role, I've got outbreak oversight. I'm told there's 2 people who've tested positive in a certain setting. I don't get their names. I don't get their addresses. I just know that they are cases to be able to help me do my job. And it's that thing about only the information you need to see, you see. And so, but I'll contact you separately.
Yeah, thank you.
So Sarah, that raises a kind of broader question, doesn't it? Which is, to what extent have you talked to some of the specialist voluntary sector organisations about some of the complexities of what you're talking about and their client groups?
So when we were setting up, we've got the contact tracing services are split between Greater Manchester and Manchester, and we know there's some voluntary sector organisations run across Greater Manchester. They're not all Manchester. So there's someone called Bruce Poole who's been part of our contact tracing system across in the Greater Manchester meeting. And so I know that he's been having conversations with people. But locally, one of the things we've been doing, what we know is we had to start by the work in our the most high risk settings, so the care homes, the schools, things like that. So we've started to pull together documents around that and working with those services. And then as we're getting different scenarios through, we're working through, we've got obviously an outline plan, but we'll need to respond slightly differently with each organisation depending on the situation. So for example, if we contacted Duncan, we would say, this is a scenario, how can we work with you to both get what we need? So we won't have separate documents and separate conversations with everyone now. We can have more conversations as we go, but I suppose there are hundreds of different scenarios that we may come across, and we'll need with different organisations that we might slightly need to respond to slightly differently. So more work to do, definitely. We can start with people who are keen to work with us now, and then there's learning that we'll get and that we can share with others as we go along. So it's a difficult situation because we're in a pandemic, and it's been described as it's like we're trying to fly a plane while we're still building it. It's really difficult. So ordinarily we would want to have a service, we would plan it, we'd work with everyone, we'd consult, we'd do all that, and then at the moment we're trying to do everything all at once, and then things get halted while we manage a situation. And but happy to work with everyone, and if you can think of areas that you would like us to start working with first that would be useful, happy to do that, and we can work through what our plans are now and how we might respond better depending on the situation.
So if people do have very specific queries or want to talk to somebody about what they should do, is it you they should talk to?
If you contact the email address that's on the slide, so the Manchester Test and Trace, right, explain what it is you want, and they will make sure the right people talk. So it might be that it's a nurse you need to speak to in our infection control team, or it might be if it's a question about testing, they'll go to the testing lead. So they will just be clear in your email what it is you're after. And if it's a more conversation more about the system and how it works, it would get through to me or to Cordell, and we could work with you.
Okay, thank you very much, Sarah. So I'll now move to Chris Binns.
I'm unmuted. No, I am. Hi, Sarah. My questions. BME communities have historically had adverse experiences of medical and scientific approaches, and are often deeply suspicious of results in test and trace in the context of events such as Windrush. What work will public health be doing to alleviate these concerns? And just supplement to that, I get lots of stuff via WhatsApp around stuff in the community, stuff's going around in the community saying avoid, the government is trying to force a vaccine on the African Caribbean community, and it's going to be tested on them first. There's lots of that kind of material around, and that's because of deep suspicions around the motives of government and organisations in the Black community. So what work's going to be done around that? Yeah,
you made a really important point there, and the myths and suspicions are understandable given historical events, and that's something that everyone needs to recognise, and we need to work differently to change that. So one of the things that I mentioned briefly earlier was we're setting up a COVID health equity group, and Cordell Beladogu is leading that, working with other colleagues in the city. And the purpose of that group is to do to give assurance really around the work that we want to do in Manchester to make sure that we're addressing the disproportionate effect of COVID-19 on particular communities. But a key element to that work will also be around communications and building up, like you say, it's a trust between the system, if you like, and people in our communities. And so it's recognised that we've got to do a lot of work around that. The role of the VCSE, well, all your organisations, is absolutely crucial in this, because it's about information coming from people they trust.
Yeah.
And I would, you know, everyone is, you want to get information from someone you trust. And if there's mistrust, or if information is being shared in a way that doesn't really sit well with you, then you're not going to listen to it, or you know. And I think as well, because more people from some BAME communities have died from COVID-19, all the experience of the bereavement, not being able to be with loved ones when they've died, not being able to hold funerals or celebrations of life through worship, you know, in ways that we would normally do that, it's going to affect those communities much more than others. And the trauma from that, and the adversity and the impact of it, you know, that has got to be recognised. So one of the other pieces of work we're doing around trauma and adversity is having that as one of our key elements of COVID recovery. And that needs to involve the people from the communities and people like yourself working in the communities to shape what that looks like. This isn't about imposing, we've got you some training session on your mental health. This is about real work with communities about what matters to people, how they've been affected, and what difference we can do by working together moving forward. And this is a key element. Obviously, I've talked a lot today about COVID response, but COVID recovery, we need much more than recovering from COVID, as we've seen from the Black Lives Matter work and everything else. We need better recovery from lots of things, and this is how we can work together to do that.
Thank you very much, Sarah. Chris, I'm sorry I can't bring you back in, just the timings. So a suggestion that's been made is that there's obviously quite a lot to talk about in terms of the test, track and trace. And I wonder, Sarah, might it be useful to have something which is a bit more of a dialogue with you and your team and a few of the voluntary sector organisations? And so we will contact you and we'll arrange that, and we'll let the people know within, we'll let people know broadly if you want to be involved in that more detailed discussion. Now, I'm aware I have run out of time. What I am going to ask though is, obviously some people might need to go, but Sarah and Fiona, could you stay for a little bit longer? Yeah. Sarah's nodding ahead. Fiona, can you stay for a bit longer, or you? Yeah, you can. Okay, for those people that can stay, we will continue. And so, Chris, is there anything that you want to come back on that briefly?
Yeah, I was just going to say that as an organisation, African Caribbean Mental Health Services is specifically orientating some of its services around the bereavement issue, because, as you know, there are the community celebrates the deaths, as you know, it's a community event when somebody dies. The funerals are large events, and the bereavement process, so things like 9 nights, etc., is quite extensive, and all that has gone for the community. So there is quite a lot of agony out there because of the inability to celebrate and people's passing. So that's quite a significant issue for us, and also the stress and pressure, both because of the Black Lives Matter stuff and the trauma the community is feeling around that, allied with what's happening with COVID-19 and its outsized effects on the Black community, again adds to that feeling of suspicion and that feeling of pressure on the community, which I think is another thing we're having to deal with as an organisation.
Thank you very much, Chris. I won't ask you to respond to that, Sarah. I think we'll just leave that there. Before we move on to anything more general, are there any other questions from people around the contact, track and trace? You can either, the easiest thing for me would be if you put your hand up in Zoom, or use the Zoom thing for doing that, or alternatively, just put your hand up in reality on video, and if I can see anybody, I will bring them in. Otherwise, just unmute yourself and say something. I'm not seeing any more questions at the moment.
I've not seen any more questions, Nigel, on the chat. There's been some good good connections made, but no more questions.
Lovely.
Okay.
Hi, Nigel. I just wanted to add that we would welcome some further dialogue with places of worship and where we could have a template that is shared right across the city. So Khan has a session on Saturday, and we're trying to get some support, although we have a GP who is looking at the government guidance and is going to be speaking to faith leaders. And we're hoping Fiona or someone in her team could support.
Yeah, and I'm having a look at that, Charles. It's short notice, and I know I've got commitments, but we'll do our best to get someone to that session, and if not on the Saturday session, certainly next week.
Lovely. Okay, I'm now going to just ask for some general questions, and so Bronwyn, I think you're still here. Can you unmute yourself and ask your question? Okay, yes.
Hi. I remember, sorry, I'm really sorry, I forgot I was going to be asked to ask my question. I don't have it in front of me. I think it was something around guidance for, I come from a youth team organisation, and it was something around if there's any kind of specific guidance that Manchester City Council are champion around reopening youth services, kind of similarly in line to schools, or if it would be done in a kind of different way. I think since I asked the question, we have had some updates from like the National Youth Agency and things like that, and we are going to be running a summer play scheme with the restrictions in place that the National Youth Agency have recommended in terms of bubbles of young people and social distancing and not sharing equipment and things. But yeah, I guess, you know, whilst I'm here, if there's any kind of further guidance or anything anyone would like to add about how to safely run a summer play scheme, or in general how to safely reopen youth services, that would be helpful.
So is there anything else to add to that, Sarah or Fiona?
Yeah, we have only just received it. I think the guidance on youth provision only landed, I think it was on over the weekend, so it's being looked at now. But both Lisa Harvey-Neville, who's the head of youth strategy in Manchester Council, and Justin from Young Manchester, and I'm not quite sure who might be on the call today here, they will be happy to support any of our youth providers in the city if they're not sure how to manage and interpret that guidance. It is very new, but it is complex as well, because managing any system like this, particularly with young people, you know, and particularly when you're wanting to have interaction, and the whole purpose of bringing young people together is to have that interaction. So there is specific guidance, but we're happy to work with you on that.
Thank you. Steve, you asked a question?
Yes. First, can I just say, Sarah, that was excellent, and I posted you should be the health minister, because that was one of the clearest responses I've ever heard. Particularly the slide about what is a contact. I've never seen that before. So, you know, put that widely. But you should be health minister, absolutely. But this isn't a question for you. This is a question for Fiona. So, if the number of daily cases of COVID-19 increases, will Manchester be prepared to lock down again? And I suppose I mean in terms of general services. And then just a supplementary question: how much are the councillors actually involved in getting the message out?
So first part of your question, would we be willing to lock down? I think you know, I think probably what people are thinking there about is would we become another Leicester sort of thing. So as Sarah said, a lot of our outbreak plans, as are everybody else's, are really around settings. So whether it's schools, care homes, hospitals, and you've seen at different points, different places who then restrict access, restrict visiting, and manage the issues within a very close space. lots of discussion have been going on locally and nationally about what a geographical lockdown might look like, and clearly then we saw that emerging in Leicester from last week. If we were going to, if we felt that our stats or our information was leading us to believe that an infection couldn't be controlled, and it became, you know, in that space of that Leicester has become, then we wouldn't make that decision on our own. Clearly, there's got to be a national discussion in the same that there was with Leicester. But I suppose what we can't do is ever take anything off the table and never say, no, we'd never do that. I think what Sarah would say in terms of the information for Manchester is that we are a long, long way from even having that as a consideration on the table. But, and that's why the information that we're sharing and the detail around the contact tracing is so important. So our focus is on making sure that we never get to that stage. And we are talking about, you know, a campaign about don't become a contact, because that is the best way of ensuring that we never have to get to that stage. But I can't say that we would never do it. But I think, as you saw with Leicester, you know, there are very, very clear you know, criteria when if you would have to, if you ever got to that stage. But the implications are quite significant for everybody. So hopefully we'll never get to that stage. In terms of a campaign, yes, there is a whole load of work going on around that campaign, and it will focus on a lot of the stuff that is in Sarah's presentation, and producing it in a way that's easy for communities, for residents to understand and take action with.
Okay, I'm going to move on to a question from Susie.
Thank you.
Hello, this is a question for Fiona again. I'm calling from a food bank. Have you got any updates on your plans and your strategies for food provision, please, Fiona?
So I've not brought anything specifically today. There are so many different facets to this, so we tend to try and break it down into specific areas of interest. But in the reports that I was referring to, there is a lot of work going on in the city, and I'm quite sure you'll be aware of that, around what does a sustainable food offer look like. When the COVID-19 first hit, a lot of that was brought together essentially because we had to change the model of delivery. But I think Angela Harrington, who is our lead for food poverty in the city, is very clear around how we move back into what is a more mainstream and sustainable model moving forward. If your particular food banks needs some connections into that, please let me know. But there is a wider strategy, and there is a lot of engagement going on with the various food banks around the city around what that looks like. We can get, I mean, that's one of the areas, one of the follow-up discussions that Nigel and I always have is what are the areas of focus for future meetings. So if, you know, looking at vulnerable people and sustainable food offer was one of those, I'd be very happy to bring somebody along to talk about that.
Brilliant. So is Angela Harrington the person I should contact?
Yes.
For a strategic thing?
Yes.
Spin. Yeah. Thank you.
If you want to do that through Nigel and myself, we can arrange that for you as well. But I am talking to Angela this afternoon, so I will make sure that she knows that people are interested to understand.
Thank you.
Thank you. Thank you very much. So we have one more question, but I think we've reached the end of our time here. However, one of the questions in the chat was, and Sarah, this is directed to you, which is around, so there is going to be a specific group that is working around, that Cordell is going to be running around equality. Could you just say a bit more about what that is, and again, about the involvement of the voluntary sector in that?
I can do. I've got some information on, I had it on my slide. So I think the group, she's trying to establish the group. So I think at the moment it's at the stage of trying to identify people who may may want to be involved, and also looking at terms of reference. So it's not started in fully, so there's opportunities for people to be involved. I'm not sure, Michael, are you involved? Michael Salmon might be aware of this group, I'm not sure, but I think there's, at the moment, they're shaping the direction, because one of the worries was that everyone would think that that one group was sorting out all the health inequalities to do with everything to do with COVID, and that's an absolutely impossible task. And one of the real things we wanted to do was have the real focus on tangible things we could do around COVID impact on BAME communities and others who we needed to see proper action. And it wasn't going to just be a talking shop. It was about, what do we need to do? How can we work differently? Who do we need to involve? And how can we come together as a whole system to deliver this? So I think it would be useful for Cordell probably to come along maybe in a week or so, a few weeks when things have been established. But obviously before then, if anyone's interested in joining that, get in touch, and we can make sure that you're linked in with the group.
Yeah.
Okay, there are a few other questions within the chat that we don't have time to do, but we will pass on all of those questions to either Fiona or Sarah, whoever is the right person to ask them, and we will try and get answers for those. So it just remains for me to say thank you very much to Sarah and to Fiona and to Michael, despite the fact Michael didn't have much chance to say anything, but thank you for being here. Thank you to everybody who attended. Hope you found it useful, and see you soon. Bye all.
Thank you.
Bye.